We started ECHO based on 4 key ideas. First was to use technology to leverage scarce resources that only exist at the University of New Mexico or a tertiary center. And in this case, I needed a psychiatrist, a pharmacist, and myself, a liver specialist. And it was hard enough to get these 3 together in a university. In a rural area, it was impossible. So we said we would use one-to-many video conferencing, like Hollywood Squares, and that we would mentor primary care clinicians to provide hepatitis C care. So that's the first idea, to use technology. And the second is sharing best practices. So what we did is we set up 21 centers of excellence for treating hepatitis C all over New Mexico. 28,000 patients had already been diagnosed and less than 1,500 had been treated because access to treatment was so poor. And 16 of these were in rural clinics and 5 were in the prison system. And in order to be a center of excellence, you had to have a general practice clinician as the leader. So we gave them our protocol, but nobody was willing to treat hepatitis C. And so I asked myself, how did I become an expert in treating hepatitis C? I wasn't born that way. And when I did my fellowship in Boston, I would see a patient present to my professor, see another one present to my professor, and then after 2 years, they started calling me a gastroenterologist. So I said, aha, I'm going to use this model to create new hepatitis C specialists in New Mexico. And the heart of ECHO is what is called a tele-ECHO clinic, so that all of these 20 would join simultaneously on an interactive video conference, talking to each other and to us, and present cases of hepatitis C in a de-identified way. And we would do this once a week on Wednesday from 3 to 5 p.m. We still do that. And they present cases. And as they present cases over the course of a year, they became experts because they were learning from us, our advice, our lectures. We would give them 15 minutes lecture and discuss about 10 cases every week. And they would learn from each other because they brought 1 patient every week and 10 in 10. They would learn on 10 in a week, 300 in every year. And over time, they became great experts. But mostly, they became experts by doing. So we would give them guidance. They would go and implement that guidance, come back next week. And we found they became such experts. And at 18 months, the wait in my clinic had fallen from 8 months to 2 weeks. And everyone in New Mexico could get access to treatment within 2 weeks. And the cure rates were high. So that's when we decided that, look, this could be applied for many, many diseases, many problems, including cancer prevention, cancer screening, early diagnosis of cancer, helping oncologists in small towns to treat cancer better, survivorship of cancer, palliative care, and other implications of the disease. And now we operate in 33 countries and have partnered with 240 universities and not-for-profits in the world to implement Project ECHO for more than 70 healthcare conditions.